I'd like to introduce today someone who's a partner of the Columbus Council on World Affairs in many ways, and we're excited that she's joined us here to introduce today's distinguished speakers. Please join me in welcoming Bonnie Hauff, the Executive Director for the Columbus Chinese Chamber of Commerce.
Thank everybody for joining us today, and I would pay special thanks to our distinguished guests to come today. You guys brought the beautiful weather here in Columbus. And the Greater Columbus Chinese Chamber of Commerce and the Columbus Council on World Affairs, we work very closely with each other, hand in hand, to make sure that Columbus is becoming a more international city and also promoting the Columbus global brand overseas. So I'm very honored to be here and introduce our distinguished speakers today. And they are Dr. Yang Zhong and Dr. Desmond Theo. And Dr. Yanzhong Huang, sorry, Huang Yanzhong, right, is Senior Fellow of Global Health at the Council on Foreign Relations, where he directs the Global Health Governance Roundtable. He's also Professor and Director of Global Health Studies at Seton Hall University School of Diplomacy and International Relations, where he developed the first academic concentration among U.S. professional schools of international affairs that address the security and foreign policy aspects of health issues. He is a founding editor of Global Health Governance, the scholarly journal for the new health security paradigm. And Huang has written extensively on global health governance, health diplomacy, and health security, and public health in China and East Asia. He has published numerous reports, journal articles, and book chapters. And in 2006, he co-authored the first scholarly article that systematically examined China's soft power. And his book, Governing Health in Contemporary China, looks at healthcare reform, government ability to address disease outbreaks, and food and drug safety in China. Our second speaker today would be Dr. Desmond Theo. And Dr. Theo is the CEO of a healthcare provider and hospital, Delta Health China, and he holds a diploma in electrical engineering and bachelor degree of science in mathematics from the Dalhousie University. And he received a doctorate degree in medicine from the Mangdai University in 1986. And he also holds a master's degree of science in preventive medicine from The Ohio State University and an MBA from University of South Australia. He recently received his PhD and DBA from the University of Versailles in applied economics with focus on China private healthcare system. And prior to joining the Delta Health China, Dr. Theo was a president and senior vice president of Healthcare Greater China of Philips, being responsible for strategic planning, business development, and overall management. And he was a senior executive in a number of global and regional pharmaceutical and medical device companies based in Hong Kong, Taiwan, Japan, and United States. Ladies and gentlemen, now please join me in welcoming our two distinguished guests today. Thank you.
Let me remind the audience we really encourage participation, and we particularly encourage participation through the note cards and writing questions. And when you have it ready, just hold it up, and it magically gets up to me while I moderate the Q&A to weave that into your program, or into the program. I also want to mention we're live streaming right now, so if you have someone that should be watching this, you can tell them to go to our site, and they can watch what we're going to do here live. And if they want to ask questions through Twitter, they can hashtag AskCCWA and send the question via Twitter. So we encourage your participation. Let me just set up the context before we go with our first question. You know, China's rise to superpower has really been something over the years that's created two of the most important economic partners in the world, the United States and China. But China's rise does come with some costs, and as we were talking about earlier with the panelists, sometimes it gets in the way of breathing. But there's public health challenges that China is facing now and will face even greater in the future. So the question today is really about how does China balance its growth with its public health? And what role does that have, or what impact does that have on the broader economy in China, the US, and the world? So we're looking forward to today's dialogue. I think as I transition over there, I'd like to throw my first question out, if I may, and perhaps Dr. Huang, you would be so kind as to answer it, but no Googling. You don't get to.
That's why I bring the laptop.
No, you don't get to Google the answer, okay? From your perspective, as someone looking broadly at policy and health and environment in China, what would you say are the top 3 greatest health challenges for China today?
Okay, great question. And I think there are numerous public health challenges, certainly, the country is facing. But if you want me to name 3, the biggest challenges, I would say, first, the environmental health crisis. Second, the population aging and what we call the NCD problem, the non-communicable diseases. And third, actually, the mental health. Some people also classify into as an NCD problem. Let's start with the environmental health problems. We know that more than 80% of the Chinese are regularly exposed to pollution. And according to WHO, the environmental burden of disease is responsible for 21% of the total health disease burden in China. And based on the 2013 study, actually people who live in northern China is, because of the pollution, has associated with a reduction in life by 5.5 years than the people living in southern China. So you see the magnitude of the challenges in terms of environmental health. Now let's move on to population aging. China is aging very rapidly. Just 1982, I'm trying to get my math right, 35 years ago, that the people who are aged over 65, the percentage was 5%. Now it's, I believe it's more than 10%. By the middle of this century, we're going to see a quarter of the population aged over 65. That would make China probably one of the most aging societies in the world. And already we have seen that about 50% of the non-communicable diseases occur among the people aged over 65. And NCDs, we know, also account for 85% of the mortalities in China. 85%, that is much higher than the world average, which is 60%. And by 2030, they say that we could see in China more than, there would be more dementia cases, like Alzheimer's diseases, in China than all the people, all the developing countries combined. So that's the magnitude of the problem of NCDs. And I'm giving you the example of the diabetes. Right? China now is the world's diabetes capital, with probably more than 100 million people suffering the diabetes. But that is not the worst. The worst is yet to come. We have already data suggesting that 1 in 2 of the adult Chinese having the so-called pre-diabetes. And according to JAMA study, that only 26% of the diabetes patients in China were actually treated for this condition. And then finally, the issue of mental health. According to a study conducted by a major hospital in China, 18.5% of the adults are suffering some kind of mental health problems. And between 2003 and 2008 alone, this incidence of mental disorder climbed by over 50%. So currently, about 180 million people, that is 1 in 8 people, suffer from mental problems, like mood and anxiety disorders. So that is a huge challenge, China is now facing.
Great, thank you for that and your riveting statistics. I think it was you that on the drive over here was saying that a former Chinese premier said even a small problem in China magnified 1.5 billion times becomes a big problem. And these sound like big problems from the start. Thank you. Dr. Teo, you're on the ground, you're in the hospital system in China, you live in Shanghai, and I'm curious, would you say these are some of the same issues that you would identify as China's major issues, and kind of what are you seeing on the ground in the health system in China, please?
Thank you, Patrick. But before I start, let me thank Patrick and the entire Columbus Council of World Affairs for this opportunity. What a wonderful and very honored. I'm very honored to be here, to be sitting among some of the old friends also here. Pat Harsh from Preventive Medicine, The Ohio State University, many years ago. A lot of other friends also from Abbott and Cardinal and other friends too. But what I'm impressed most, Patrick, is that you not only, the World Council not only look at folks like us, but also making opportunities for young people and see high school students who are learning to speak Chinese. Hopefully you have a chance to be in China and really get into that environment and speak the language. I tried to learn Italian at one point and thought when I was in Rome, but once I get to the Italian cheese and food, I forgot the language. It's very difficult, just great food over there. But most important, thank you for the opportunity. And secondly, to be able to answer the question, you need to be an expert. And I'm only 11 years in China. I'm no expert at all in the Chinese economy and healthcare, especially healthcare economy. You realize that when you study more and understand more, the more you realize that you don't understand more and need to learn more. So I think it's a great platform over here, an opportunity for us, all of us, to learn and to get into the better of our health in the next years. And to answer your question, this morning I woke up walking around sneezing. I guess I'm allergic to the clean air in Columbus. My IGs are up, it's because living in Shanghai and very lucky the last 11 years to see the economic impact, right? Especially when you're seeing houses pricing coming up, people are changing from bicycles to motorcycles to mopeds. A lot of cars right now, highways all over the place. Just to have a survey over here, how many folks in this room has been to China? You raise your hand. So quite a few of you. So you know what I'm talking about, right? And if every 6 months you've not been there, you say, my goodness, what happened here? The roads have changed. Another highways, another set of constructions going on. So that's what's going on. And as in any developing country, and they still call themselves developing countries, China, you're going to find a lot of headaches, a lot of issues, not only in the water quality, the air quality, the food quality, but also overall as we get aging, like Professor Huang has been saying, the aging population, the demands for care, where we are right now in the area of what I'm doing in healthcare business. But our hospital, Delta Health Hospital, particularly focused 80% on cardiology, cardiovascular diseases. So we do open heart surgery, we do aortic dissections, but we also do percutaneous interventions, we do angiograms. But 20% of our service so far has also been switching to taking care of pediatrics. That's why talking to our friends from Abbott Nutrition in the area of the neonatology, we're not there yet, but you can see the impact on children, the breathings, the asthma. So I guess my lungs are already used to those particulates, the PM 2.5. As we call them. Remember those, PM 2.5 particulates. Those particulates enter your lungs easily, very easily, and tend to be floating about 1 or 2 meters above ground, and so it impacts the younger generation a bit more. Very interesting, but let's chat further. I'm sure there's going to be questions about not only air quality, one of the many challenges all of us are facing in this world.
Yeah,
Thanks,
great,
Patrick.
Great, thank you. Maybe we stick with you just to ask a basic question that that I think we all might help benefit from, which is, how would you describe the Chinese healthcare system as compared to the one we may know here in the U.S.? Same?
Well, I think to answer that question, you need 3 PhD and
perfect.
theses and 10 years to, it's quite complicated. As you all know, Chinese is a communist system, centrally controlled, including healthcare, and since the 1940s has been under one system. But it has evolved over the years. In the 70s, in the 80s, particularly late 90s, where the healthcare system has started changing to better the quality of health for China. But it's just way too big. We have over, at last point count, I guess, it's over 1.4 billion people. They're spending about 5.6% of GDP on healthcare. So roughly about $900 billion US. Still far behind what we spend in US. Maybe roughly, we spend what, 18% roughly? Maybe closer to 18% with Obamacare and many other, more things to come, right, you guys? But in China, they are looking at different countries, the experience of different countries, European systems, UK, Germany, and of course US and Canadian system, and trying to find ways that can cater to us and the generations over there. But it is to briefly put it, used to be 100% government-owned, government system. When you get sick, you go to the hospitals. They are all owned by the government, right? Nowadays, certain percentage, the government knows that you have to open up the private healthcare side. So roughly about 10-15% of healthcare services being open to private healthcare. So Delta Health is one of them. And we are very lucky in a sense also we are a foreign invested healthcare. So right now it's opening up. In the past, for healthcare, certain areas, communications, for example, are not open for foreign investment. But healthcare right now, especially in hospitals, especially in rehab or all this care, pre and post hospital are being taken care of. However, let me put it in a context that some of the young people and you folks are going to be very happy about this. I think it's like when in the 90s we talk about cell phones, right? Cell phones are the thing. And we have landlines also for the phones, right? I mean, in China, basically, they didn't go through the landlines a lot. They just jump into the cell phones, right? So healthcare, what I'm looking at is potentially you're going to have the Fitbit type of wearable in the future. Like what we're going to work in our hospital in the future is that if you're a patient, by the time you leave this hospital, you'll have a wearable that can measure your heart rate, your EKG, your activities, even the sweats you're producing will be able to measure your blood glucose, and then that goes into the cloud, right? With your blood tests and laboratory exams, all past CT scanners and MRI data that's available on the cloud, and doesn't matter where you go. So this is very global. You're in China, you're in Singapore, you're traveling to the US, and you're seeing a doctor, you can just get them, right? That's where I see the private healthcare also moving, and also government is really trying to work also with us to see moving along. And so one day my dream is that somebody coming through our hospital, as he enters, we already know on his Fitbit that whether he is Cigna, Aetna, United Health, or whatever insurance is in, his ultrasonographer is waiting for you from 2 minutes now, Mr. Smith, and after everything is done, you just walk out and we'll send you the bill. Yeah, and that's the dream, right? Yeah, but I think it's possible right now with technology. So young people, especially those who are learning Chinese right now, learn both English and Chinese, you'll be able to help us on the Fitbit side. Yeah,
exactly.
Thanks.
Thank you. Yeah, the future is, and the young people are a key part of that future that you dream. And I wonder if Dr. Huang can talk to us a little bit about the not the future dreams, but the current challenges, and in particular around pollution, air pollution. I was curious, like, we see a lot in the news, at least here, the health issues we often hear about, at least for China, is the smog and closing down airports, or certain days you can drive and certain days you can't. Can you kind of help us from a broad perspective, like how big of an issue is it? What policies is the Chinese government utilizing to manage that? Both health policy and PR policy.
Well, if just to focus on the environmental health issues, here we talk about the harm it's done to the people by the air pollution, water pollution, soil pollution associated certainly with also food safety issues, and that is indeed a big problem, as I already just explained. That if you look at the PM 2.5, certainly that's a big challenge. But if you look at water pollution, more than 60% of the main rivers in the country have been polluted. The soil, that much of the information is still in state secret, but the official media admitted that 20% of the soil in the country has been polluted. And that is a big problem because, for the soil pollution, just to treat them, it's a big challenge because it would take sometimes decades, if not maybe a century, to make it this reversible. So the government since 2005 has realized that this is a problem, but the real challenges did not occur until 2013, when suddenly this PM 2.5 become a huge problem. And thanks to the U.S. Embassy, by the way, they built a device on the rooftop of the embassy, basically, sending information about the PM 2.5 level to the Americans in China. That the Chinese immediately, the government protested and said it's illegal of doing that in China. But that actually helped, prompted the Chinese government taking action on air pollution. We have seen the government becoming more transparent on the issue. Now the information, the PM 2.5 level, has been reported on real time online for 113 major cities in China. The government has released 3 action plans on air pollution, water pollution, and soil pollution. And the Chinese president was promoting the idea of so-called ecological civilization. He even said recently that the health is the prerequisite for development in August. That was August last year. And so that was all very encouraging, but the challenges is just too many, I would say. Just to name a few, one of the challenges is still that dilemma, between economic development and environmental protection, because taking these radical measures to address the environmental challenges would, at least in the short term, means slowdown in the economy. But the problem is that the government cannot afford to have a slow economic growth rate, because they will talking about this so-called middle income trap. They don't want to be stuck at this middle income level. They want to jump into the developed country status. But they say that for that, to achieve that aim, that objective, we need to have at least a 6.5% annual growth rate. They will, ever since, that you've seen that the official statistics report, like a 6.5% annual growth rate, but we all know that, this is not reliable, the data, and some people even said if it only had 5.1% growth rate, that would be very good. This is a dilemma between economic growth and development. In fact, one of the leading government economists, Justin E. Flynn, recently even said, well, to treat the problem pollution, the only way is to have faster economic growth. So I found this is very interesting.
Very interesting, indeed. Thank you. We'll switch to some questions that we already have from the audience. It also has to do, perhaps, well, I don't know if it has to do with the younger generation or not, but the stat here says China has 350 million smokers, which that'd be more than we have in the U.S.
15 million.
15?
350 million.
50.
That is 30% of the world total.
So this is an accurate stat. 350 million?
Plus and minus a few million.
Maybe a million. It's
The secondhand the victims of secondhand smoking.
yeah, exactly. That's one, or it's
That's
just a
700
U.S.
million,
population.
actually, by the way.
Well, the question is, how is this going to affect healthcare costs? And there's another question.
That's what you want to
There's
take.
another question right after about, besides diet, what health behaviors are contributing to chronic disease, particularly the tobacco use. So, do either of you want to take a first?
I'll take a first step, and then maybe Dr. Huang also can. Well, I mean, smoking is definitely one of them. Yeah, over 300 million people, and still growing. Unfortunately, the younger generation is picking up, and particularly on e-cigarettes, and so that's chemical cigarettes, right? One thing good is that a few years ago, the government has already said that in China, Chinese government said that certain places you cannot smoke. In the past, you can smoke inside restaurants, you can smoke inside bars, buildings and things like that, airports. Nowadays, you can't, except for the airports, they have a smoking room. And then you can smell it miles away as you walk past. Because the cigarettes in China are the heavy type, But also we have a lot of imports. The Marlboros, the Camels are coming in. A few years ago, when I was at Becton Dickinson, we did a small study about this and realized that especially on trains, people take a lot of trains and time and the exposure. You have a lot of secondary smokers affected, and so affect their lungs. And it's not only short-term, long-term wise, especially children, and then you come into the pollution side. So it is significant. Diabetes is another one, right? Over 100 million at this moment, thinking of pre-diabetes or potentially in diabetic form. Also partly because of food. We are not eating as healthy as today, like a good salad and chicken. Right now in China, there's the number of Kentucky Fried Chicken, the number of McDonald's. I'm not trying to blame the U.S. for. We also have good stuff. Starbucks, I can't survive any day without Starbucks coffee. But the diet is changing, the environment is changing, so challenging, facing all of us facing ahead. But no one answer. But Professor Huang, maybe you can help us also.
Thank you, Desmond. I think tobacco is one of the biggest public health risk factor in China. If you talk about, again, 350 million smokers, 700 million victims of secondhand smoking, and also each year 1.2 million people died of smoke-related diseases in the country. And China, in 2005, joined the FCTC, the Framework Convention on Tobacco Control, committed to tobacco control, and this is an international treaty, by the way. But so far, China has turned out to be one of the least effective in tobacco control in the world. The point is that the problem is that even though the Ministry of Health was promoting for tobacco control, but the special interest groups that they're very resistant, to these efforts. They actually found their allies in the central government, which is the the Ministry of Information and Industrial Technology. They oversee the State Tobacco Monopoly Administration, which happened to share the staff with the China Tobacco, the largest tobacco producer in the world. It's just like you have Philip Morris people sitting at the FDA, basically doing regulating tobacco. So they have been very resistant, to any effective tobacco control efforts. They have also essentially diluted all these efforts to comply with the FCTC. And now what you have, indeed, the First Lady, Madam Peng, was one of the major champions for tobacco control. But I think China could have done more. I think the least the government could do is to have the president coming out, speaking publicly on tobacco control. But so far, we haven't seen any top leader coming out, doing that kind of promotion. I think that's very unfortunate.
Great. Great. More questions. This one is from someone in the audience. Why do we see, or why do so many pandemics start from China, like avian flu, et cetera? First of all, would you agree? And if so, do you have a theory?
Desmond, you want to do that? Okay.
I took the first step just now. You take this step right now.
Okay, all right, sure. Yeah, historically, well, I think that's right. Many of these pathogens, infectious diseases originated in China. There's a laundry list of these diseases, pathogens, from SARS, certainly, H7N9, H5N1, and this rumor has it that the 1918 Spanish flu, which was, cost lives maybe 35 million worldwide in 1918, according to some historians, also originated in China. Indeed, I think that I agree with that statement. Maybe because China is just too large, too populous. Imagine there's 1.3, 1.4 billion people. Use different cultural habits. Is the typologies. Climate conditions. Easy to feed all those dangerous pathogens, and certainly the economic growth contributed to that. The problem, that SARS, for example, is believed to be associated with this cultural habits in Guangzhou, right? People like eat this civet cat. You probably, I don't want, no offense to Cantonese, but they say the Cantonese would eat anything 4 legs except the table. So I think in that sense, I think this is indeed the case.
Yeah. I remember many years ago when I was at preventive medicine at Ohio State and talking about epidemiology and public health and all this pneumonia, influenza, type A, type B every year when it starts, right? One of the things that I still remember the professor said is 3M, like not M&M, but 3M. One M, the first M is man. Man doesn't matter man or woman, but man is there. Second is mobility, and third is money, right? Money, you can buy anything you want to eat, whether civet cat, mobility, you can fly all over the place, right? And also being there. So whether you're in Africa, you're in southern China, once you have those confluence of things together, the opportunity to spread out pandemic-wise will be very easy. I think in southern China, especially where you have Hong Kong, Guangzhou, where the number of men, the population-wise is very large. And then once you have poultry and livestock very close to humans, to city dwellers, the transportation of those vectors very fastly get into the systems, right? These days with flying, like yesterday, couple days ago, I was just flying from Shanghai into New York City, Newark, one flight. In the past 20 years, you have to probably stop by a few times. So if I have anything, if I have any influenza virus, I can transfer very, very easily into one place or the other. So I think, luckily so far, we have a pretty good, the United Nations World W Health Organization watching this, but it's keep on evolving, just like us, right? Viruses, new breed of viruses, and antibiotics. Right now, we all know that a lot of resistance to that. My father was in the hospitals 4 years ago. He passed away 3 years ago. MRSA was really big, nosocomial infections. You just come out with vancomycin. I mean, when I was in medical school, vancomycin is like the nuclear power. You can only use it one time. Right now, they just put it drip every day because you have nothing else to do it, to kill the bugs. So it is going to be a tough one ahead of us, and once, especially pandemics, you have shorter time to react to it. So hopefully with our technology, we'll be able to pick it up a bit more easier. And nowadays, you come out to the airport, you'll see all these sensors and scanners. It's not. I don't think it's enough. Yeah.
Thank you. This next question takes us into the economic impact of health, and it reads, please comment on health-related absenteeism from work. How much of an issue is this for employers, and what priority is this receiving in China?
Very good. That's a very, very good question. Very deep question. Very deep question. In China, if somebody, let's say in my team, or when I was not working in the hospital right now, let's say when I was working in Philips, right? One of my team members, let's say my secretary, has a flu, has runny nose, fever, and things like that. When in Singapore, US, you just go to a GP clinic, be back half an hour to 45 minutes, maximum an hour. Right? In China, it takes 1 day because she has to go in, make an appointment, be on the line, see the doctor, and then after that, do the testing, pick up medication, and then come back. Takes a lot of time. So it takes an impact, you can imagine, on the economy. Not only the economy as a workforce-wise. That's just my secretary, right? Imagine other folks, right? So if we can reduce that efficiency, we can increase that efficiency in that part by having more access, easier access, and also GP family practice clinics. Right now, we don't have it outside, except in major hospitals. So it does, I think one of the things the government has in mind is about changing that part. The dental part actually is better, is much better. So you have a toothache right now in China, in Shanghai, you can just get it done within half an hour, 45 minutes. Very reasonable too. Yeah, very reasonable too. But if you have a influenza or you're coughing like crazy, it takes a while. So still mismatch, but we can see that there's some improvement being made, especially in like our hospital, Delta Health Hospital, right? So if you go to my secretary, let's say she has that situation, she goes to the government hospital, she'll spend about 100 RMB, which is about, let's say, 15 US dollars, right? If she comes to my hospital, she probably pay double that, 200 RMB, but she gets immediate care. Within half an hour to an hour, she's out. Yeah. So you can see the potential of healthcare opportunity, also the impact on economy-wise, how they're going to see, these private clinics coming up, better service. But I only see positive impact. Folks want to get into the healthcare arena right now. The healthcare platform in China is the best. Aging population, a lot of young population, a lot of money also to be spent in this area. So on the economy side, yeah.
I believe there is actually statistics on the health-related absenteeism. If my memory serves me well, it's like 5.5 billion work days lost annually due to that absenteeism.
For the economy overall, not just China, but thinking about should we care about it here in the U.S.? I mean, should we care that there's an aging population in China? Should we care that the air pollution, environmental pollution is an issue? Should we care that there's 5.5 million days? What sort of now thinking from the U.S. policy perspective and U.S. economy perspective, does this impact us?
It does. We have to care about it because the world is not isolated. I mean, China, as I mentioned earlier, about flying and things like that. So the impact can be very, very dramatic and very close in time. In the future, with the new airplane that can take off short runway and get into smaller airports, the connection even will be faster, right? So the economic impact is going to be there. Exports, right? What we're doing in the U.S., especially in medical device, in pharmaceutical area, in Abbott Nutrition, for example, Ensure for non-diabetic and diabetic patient, for pediatric patient. Those are the needs that we need in China right now. Right? Our mothers in China do not trust the Chinese milk, right? So the U.S. milk, Australian or New Zealand quality of milk is much better. So those type of things going to impact. I'm just giving a small slice of the impact, but it can help us on the export side. I don't want to import our influencers to you, but the setup of vaccines, the knowledge that can be shared at a much higher level, university level, can also be done. So foreign students, for example, OIAs. I would say the connectivity over there, the exchanges. I think the more we understand each other, the better. Not isolate us, from one corner to the other. China is very big. I mean, from the north, I was in Harbin area, which was minus 25 degrees centigrade, and then I had to fly to Singapore to see my brothers. That's 26 degrees centigrade. So you can imagine. But the China part is very wide, and so the temperature difference also quite amazing. And so it impact also on the clothing. So what we can do over here with the quality of our invention on our clothing, for example. The Gore-Tex, right? We take it for granted right now. But I was at minus 25 degrees in Harbin. I tell you, Gore-Tex is my buddy, is my friend. It's so cold. My feet were numb. I didn't have Gore-Tex shoes or Gore-Tex socks, but at least I feel very warm up here. But so it's a wide variety of impact, and so we should be pay attention to that.
Thank you. And then Dr. Huang, if the Secretary of State came to you and the Secretary of Commerce came to U.S. Secretaries, why should we care about all this health in China issues? That's in China.
Well, if you look at the trajectory of the U.S.-China relations, right, it's basically becoming that bilateral relationship has become more complex and more multifaceted, right? Just 2 or 3 decades ago, we were focusing essentially on the 3 T's, right? Trade, Taiwan, Tibet, and human rights issues, the traditional issues we focus on. But nowadays, it's being expanded to issues like climate change, global health, nuclear non-proliferation, etc. Right? So let's talk about global health, right? As Desmond has alluded to, right? That a disease that originated in China could quickly travel to the United States with jet speed, right? In fact, every corner of the United States is reachable within 36 hours of flight. So if you watch that movie, Contagion, right? That's you see how this disease, this novel, dangerous disease, could travel from Hong Kong, right, in the restaurant, to not Mississippi, our northern state. I suddenly forgot the name.
We forget it too.
Yeah.
Not Columbus, Ohio.
No,
Michigan, Minnesota, or Michigan?
Minnesota. I'm sorry,
Minnesota.
Minnesota. Right. That this is the how is in a globalized world. Right. The one country's health problem could be another country's as well. And secondly, if you look at that bilateral economic relationship, the U.S. is China's largest trading. Second largest trading partner, trailing EU, and China is the United States' largest trading partner, right? And China is also one of the engines for world economic growth, right? We talk about three engines of world economic growth: United States, China, and India, right? Economic slowdown spawned by poor health could immediately have implications for world economy, like environmental health. We talk about this recent World Bank study. They found that just environmental health problems actually caused a 10% loss of China's GDP. That's about $680 billion. So the economic, if you talk about economic interdependence and globalization, right? China's economic problem is also U.S. economic problem.
Good, thank you. This question is about U.S.-China. How do you think collaboration between U.S. and China can address the healthcare issues in China? And is there collaboration happening now? Is it a...
Well, you want me to take the first question? Sure, yeah. I think this is twofold about this to answer that question. First of all, I think that China's economic growth, including the growth of the healthcare industry, posed tremendous opportunities for the U.S. healthcare industries, hospitals, the medical devices sectors, the high-tech industries, before my departure to Columbus, I had a phone call with my friend in Shanghai who's in the medical device industry. And he said, now that the government is imposing restrictions on capital flow, outflow, they are actually doing this industrial park, working this industrial park in Zhejiang province. Said, we welcome the United States to invest in this area. They don't need to bring the money. We have the money. They just bring in the technologies. We could work together to make money here. And he also asked, do you know there's any like a clinic in the United States who want to be on sale? Like if it's less than $250 million, we could buy it. So this indeed, there's tremendous interest, right, in doing business with the United States. I'm sure the U.S. has had a similar interest, right, in China's booming healthcare sector. That a couple of years ago, I was asked by investing in the United States whether I could help them, broker a partnership with some of the Chinese hospitals because they want to invest there. But I think that cooperation should not be confined to the business opportunities. It's also about the two countries work together, to address the common challenges we face, issues like HIV/AIDS, issues like the pandemic flu, issues like climate change. This is something the United States and China could work together and could work well. And we already have seen the US CDC in China, the health authorities work together on pandemic prevention and control. Essentially, like the H7N9 outbreak, once this is just reported, within 24 hours, the US got the samples from China to develop the diagnostic tools for the possible outbreak in the United States. I think there's a lot of this unrealized potential for the United States and China.
And I would agree with that. I would say that there's a lot of activities going on at government levels, at the private sector. But I would say that it can be even more at the university level, at the research level. Just give you one example. The reason why I'm here the last few days and also this week is that our hospital, Delta Health Hospital, has a collaboration with New York Columbia Presbyterian Hospital. And so heart disease is, of course, is one of the major issues in our heads and our minds, not only private citizen, but also government. So one of the things that we want to do with exchange of information and exchange of technology and ideas is to have two of our doctors. One doctor is a very famous Professor Ge in Shanghai, and one doctor is a very famous Professor Marty Leon from Columbia New York Presbyterian, to be together at one spot in Shanghai in our hospital, and Professor Ge will be in the operating room doing on a patient with live TV, and Professor Leon out in the auditorium in our hospital explaining what is this very sophisticated, very difficult, because he just, a very advanced procedure. And then it's going to be televised, live stream. Yeah. So the more, I would say, this type of exchanges, sharing, hopefully we can do similar with the Ohio State. I'd rather go over here than, Michigan, see Wolverines. But so tomorrow I'm meeting Ross Hospital, our hospital, cardiology hospital, to see how we can do more of these. But it starts from one person to 10 people to the entire community. So hopefully with the World Affairs, you guys are doing a great job to start also in that area, to help us make that bridge and start sharing with regards to positiveness on, and then we can really help collaborate more. Yeah.
Sounds very good. Our live stream viewership might go up once we start showing some open heart surgeries.
Yeah, absolutely.
Maybe that'll help our views. We have time for one last question, and it goes back to the comment, I think it was you, Dr. Huang, that said that China will have more people with Alzheimer's than every country combined.
Every developed country combined.
Every developed country combined. What kind of population level prevention is happening in China?
You mean the preventive measures?
Well, it sounds like you could address that, or how is China preparing for that reality?
Yeah, before I answer that question, let me tell you the story, right? That my hometown, my neighbor, is this man who's there in his 70s, 80s, got old, and he developed, this condition, what the local Chinese called 老年痴呆, but I don't know how to translate in Chinese, but it's essentially Alzheimer's disease. But when they use the Chinese term, it's a very negative connotation there, But they didn't know that it was a disease, that it was Alzheimer's. So one day he walked out, but there was no preventive measures, no care, nothing. So one day he walked out, outside, then he just disappeared, never returned. And his son looked around, the county, neighboring counties, never to no avail. And he just disappeared. I'm sure, each day in China, there are hundreds of thousands of such stories being repeated in the country, because essentially, the poor health education about the disease, the awareness of the disease is very poor, and not to mention also the care of the Alzheimer's disease patients, because I don't think has yet been covered by the health insurance schemes, especially in the countryside. The government has unveiled recently the action plans on NCDs and non-communicable diseases. And I hope they would target, prioritize that, in the package.
I think Professor Huang has already answered most of that, but Alzheimer's, and in also many other geriatric challenges we are facing, is going to be more and more with aging populations coming up, right? We're facing in the U.S., we definitely will be facing in China. But the way to solve, hopefully, this type of problem is to have more collaboration. There's a lot of smart people in the U.S., a lot of smart people in the U.S., a lot of smart people in China and other parts of the world too. If we can get a council like this together and talk about problems and find solutions, and talk about more the glass half full rather than fighting each other and killing each other, finding potential answers for curing Alzheimer's or cancer is still a few major steps away, but I think it'll be much better. The economics will be even better after that. So I really tip my hat off to you, Patrick, and the team for the opportunity to speak today and also spend the time talking about some of our ideas. Of course, these are just some personal ideas, but hopefully you understand where I'm coming from. Thank you.
Well, thank you. Thank you for helping close on a positive note as we look to the possibilities that we can do to make the world a better place. Please, again, join me in thanking both Dr. Huang and Dr. Teo for their insightful conversation.